Hello, everyone. Welcome back. Today, we'll be discussing an important women's health topic, uterine fibroids, which are very common among Nigerian women and women of African descent. So let's start. What are fibroids? Uterine fibroids are non-cancerous growths of the uterus. They could vary in size from as small as a seed to as large as a melon. Most women may not even know they have fibroids. In others, they could cause health issues. So, what is the pathogenesis of uterine fibroids? In other words, how do they come into existence? Uterine fibroids develop due to a combination of genetic mutations, hormonal stimulation, particularly estrogen and progesterone, and growth factors. All these cause abnormal growth and proliferation of a single smooth muscle cells in the uterus. And this explains the variability in size, number, and symptoms among different women. This also explains why fibroids increase in pregnancy because of high level of estrogen and progesterone, and also regress after menopause because of low level of estrogen and progesterone. So what are the risk factors for uterine fibroids? Uterine fibroids are more common in Black and African women, usually appear in women of childbearing age between the age of 25 to 45 years. Other risk factors include family history, obesity, early menarche, diets, which are low in fruits, vegetables, and high in red meat. Also, stress and lack of access to healthcare could also contribute to late diagnosis of this. So, what are the symptoms of uterine fibroids? Heavy or prolonged menstrual bleeding, which could lead to severe anemia, which is low blood counts, pelvic pain or pressure, frequent urination or difficulty empty bladder due to pressure effect on the bladder, constipation due to pressure effect on the intestine, infertility or recurrent pregnancy loss or miscarriages and the pregnancy complications, abdominal swelling, which is distension of the belly, sometimes mistaken for pregnancy in Nigeria. All this can reduce quality of life. So, how do we diagnose uterine fibroids? The most common and the most avoidable way of making this diagnosis is by using pelvic ultrasound. And also, we can also use magnetic resonance image, which is MRI, but this is less available and very expensive. So, what are the treatment options that are available for uterine fibroid? So, one is watchful waiting, especially if patient has no symptoms, if they are asymptomatic. Other treatment options include medications. So most of the time, this medication helps to control the bleeding and they help to shrink the fibroids temporarily. So these medications are divided into two. We have the hormonal therapy and we have the non-hormonal therapy. So let's start with the hormonal therapy. So the first under the hormonal therapy is gonadotropin releasing hormone agonist, example like leuprolide. So this medication, they help to temporarily shrink the fibroids and they are used before surgery to reduce bleeding and size. Couple of side effects of this medication includes hot flashes, like somebody is going through menopause, and it could cause bone loss, especially if patient is using it for long period or long-term use. The next medication on the list, we have the gonadotropin releasing hormone antagonist. This one helps to reduce heavy bleeding and it also shrink the fibroid. The next on the list is progestin releasing intrauterine device, which is IUD. This helps to control heavy menstrual bleeding, but this does not shrink the fibroids significantly. We have the oral contraceptive pills and progestin, which helps to control menstrual bleeding, and also this does not shrink the fibroid. And then we have the newer emerging therapy, which is selective progesterone receptor modulator, which helps to reduce the bleeding and also the size of the fibroid. And this is the usage of this is very restricted in some regions due to the rare liver toxicity of this medication. Moving on to the non-hormonal therapies, we have the TSA, which is tranexamic acid, which is a non-hormonal option, and this helps to reduce heavy menstrual bleeding, and this is taken during menstruation. We have the non-steroidal anti-inflammatory drugs, which are NSAIDs. Examples include ibuprofen and naproxen. This helps to reduce menstrual pain, but does not affect bleeding volume, and it does not shrink the fibroid. So moving on to the next treatment option, which is surgical options. Here we have the myomectomy, which is the removal of the fibroid, and this is a good procedure if somebody wants to preserve their uterus. In other words, they want to preserve their fertility. We have the hysterectomy, which is the definitive treatment, which is the removal of the uterus along with the fibroid. Moving on to the minimally invasive options or treatment options. These are not widely available in Nigeria. Example of this procedure include uterine artery embolization, whereby you block the artery that is feeding the uterine, that is feeding the fibroid, thereby allowing the fibroid to shrink. We also have the laparoscopic surgery, which are very good, especially for cosmetic reasons. And the last treatment option is lifestyle modification. So this includes healthy diets, and this diet includes diet that are high in fruits, vegetables, low in red meats and fat. Exercise is also part of the lifestyle modification, and lastly, managing weight loss, because estrogen could be produced from fat or adipose tissue. So getting rid of those excess fats could help to shrink the fibroid. In summary, uterine fibroids are common, but they can be treated. If you have symptoms like heavy bleeding or pelvic pain, please see your doctor early. Don't forget to like, share, subscribe for more health content. Follow us on YouTube, TikTok, Facebook, Instagram for more content, and I will see you in the next video.